from Jerusalem. Dominic, thank you very much for taking the time to speak to us. I mean, there are real worries, as you heard in that piece there from Salma Abdelaziz, and concerns about the spiraling as well, deteriorating conditions inside Gaza. Just give us a sense of what you're hearing, your teams on the ground, what they're hearing, what they're seeing.
Well, thank you. Since Saturday, it's been a horrifying week. I think the unfolding humanitarian crisis in Gaza is truly catastrophic. We're deeply concerned about the 1 million women and girls in Gaza, and as your report just noted, one of the most densely populated places on earth, even more under duress. And for UNFPA and I, we're deeply concerned about the 50,000 pregnant Gazan women who can't access maternal health, and they're facing a double nightmare. And we see this as a broader challenge of the healthcare system, which was already under significant duress. It's a healthcare system which is crippled, it's under attack, and it's on the brink of collapse. And these pregnant women, 50,000 estimated pregnant women, have nowhere to go. So they're really facing unthinkable challenges.
So given what you've just told us there, Dominic, I mean, with no water, electricity, lack of food, medicines running out potentially, how do you help these 50,000 women, the thousands of pregnant women? How do you safeguard them and their children?
Well, there's a really important point to your question, which is around safeguarding. And I think this is where the Secretary General has been very clear in terms of respect for international humanitarian law. Civilians, including those pregnant women and healthcare facilities, they are not a target. And we call for their protection. The violence has to end, the siege has to end, the humanitarian aid must be allowed in, and every party to this conflict must respect international humanitarian law. All Gazans and the pregnant women of Gaza as well have their rights and have the right to access hospitals and healthcare facilities.
We've been reporting that Israel has asked people in the north and in the city of Gaza to move south, but I know some healthcare facilities telling CNN they just can't comply. In their words, it would be a death sentence for patients. What are women telling you? I mean, are women making the journey? Are they unable to make the journey? These are really crucial and hard decisions, not just for themselves, but for their children.
And their unborn children as well.
Yeah.
The testimonies of the pregnant women that our team has heard from, I mean, UNFPA part of a much bigger team of the UN on the ground. But the stories we hear, just to give you one quote, if I may quote one of the pregnant women that we've heard from, that I couldn't help but think about how my baby was feeling with every explosion. And this was a pregnant woman from the north of Gaza who was part of this displacement, as you described earlier, feeling those bomb blasts. And she was gathered in one of these designated emergency shelters after their home was destroyed. And they're seeing the chaos all around them. They're on these cold floors without mattresses. As you mentioned, not much food, water, electricity with fuel, and medical supplies are getting in. And she's worried about what's going to happen next. Where is she going to go when she's approaching her final trimester, where we know complications with births will happen, and even more at risk now when they can't access those healthcare facilities. We've also spoken with midwives and doctors on the ground, those of which we support. There's a midwife in the Al Shifa hospital who part of this one of these many healthcare facilities that are under significant duress, saying that since the start of the escalation, they themselves, these midwives, have been separated from their own families, trying to work tirelessly with limited resources under major security challenges and risks, trying to support those pregnant women again. So this is a major catastrophe on the ground.
Dominic, I really appreciate you giving us some insight and really telling us the stories of the women on the ground. Just the situation on the ground, incredibly dire, and you raise a very important point in terms of safeguarding those 50,000 pregnant women, the importance of that. Dominic Allen, really appreciate it. Thank you very much. Keep us posted on any developments, Dominic.